Well, when mask mandates were lifted, many of us thought, yay, we're done with masks. Maybe you even threw some of yours out. But now with the spread of the Delta variant and cases going back up for some folks, we're seeing some of those mandates come back, but it's kind of all over the place, right? From schools to businesses, even the city of Charlotte is going to require masks in city government buildings starting today. And some are just recommending that everyone wear a mask, so it can be confusing. Dr. Keaton Amin is an internal medicine specialist with Novant Health Presbyterian Internal Medicine, and he joins us this morning to talk about where we should be when it comes to masks. Good morning, doctor. How are you?
Good morning, and thank you for having me.
No, thank you for helping us, because let's just start with that big question. A lot of people are saying, I'm vaccinated, why do I need a mask? If you're vaccinated, should you be wearing a mask?
Well, let's start with what's going on currently. Obviously, we are aware of the Delta variant of COVID-19, and it's a lot more contagious, a lot more transmittable than the previous original variant. What we're seeing right now is the majority of the patients that are getting sick are the unvaccinated. In the hospital, it's over 90% of the patients in the hospital are unvaccinated, and the remainder, 10% or so, are patients that have been vaccinated, but they are the ones with more severe, significant conditions, comorbid conditions, and elderly. We are also seeing patients that are previously vaccinated catch COVID-19 infection. So going back to your question about should we still wear a mask, I would say that if you're in a crowded place, indoors or even outdoors, and it's an area you know that the number of infections is rising, it would be a good idea. You may catch COVID-19 even if you're vaccinated, but the vaccine keeps you from getting severely ill. And that's the most important point, is that if you catch it, and I've had a number of patients that have gotten COVID-19 after they've been vaccinated, all of them have had very minor symptoms. So if you're saying then, well, okay, if it's minor symptoms, what's the big deal? Because then you're also continuing to spread it. If you're not wearing the mask, you catch it, you may not even know for a few days, and then you can go around spreading it to other persons that did not get the vaccine, or even if they did. So it's still continuing that process. But the key thing is that if you get the vaccine, you won't get severely ill.
Let's just talk about schools for a second, if we can. I've talked to a lot of parents who are wanting their kids to be safe, wanting their kids not to either contract COVID or bring it home or any of those things, but their kids are in schools where masks are not mandatory, and that's really making a lot of parents uneasy. What is your advice to parents with kids in schools about masks?
If they are older than the age of 12, they are eligible to get vaccinated. If they're younger than the age of 12 and they're going to school, I would recommend wearing a mask. They could catch the infection, obviously, from other children or other persons, and then spread it to other children, adults, or even their parents, and anyone else they come in contact with. So even though they're a low risk as far as overall infection and severity, there's a lot more children getting sick now than there ever was before, and it is because of the Delta variant.
If a child is in a school where masks are not required, but they choose to wear a mask, or their parents choose for them to wear a mask anyway, is that enough protection? Are they still protecting themselves and the people around them, even if other kids in the class aren't wearing masks?
They are getting protection. It may not be the most ideal protection because both parties are not wearing a mask, but it is a good amount of protection.
Perfect. Dr. Amin, thank you so much. There is so much to talk about with this. We wish we had an entire hour to sit down and talk about it, but we appreciate the information you've given us this morning. All of the information for Novant Health on the screen right now. Dr. Amin, thank you.
Thank you for having me.